Hello, everybody. Yes, it's DENI, and I'm here because I think it's time to add a little bit, if I can, to help you out and give you a few tips if I've got any, for my vast knowledge. Anyway, just to let you know, yes, my degree is in special education. It's actually more specialist, a diploma in specialist teaching, which is in behaviour and learning. So that's not actually special education as such. However, I have had a lot of experience with children who have got all kinds of difficulties, let's say, and so I do know a few things about how to change life for them and what to do to differentiate the curriculum to manage them better. And when I say manage them, it is about, to a large extent, about us. It's about us having to change our thinking a little bit to actually accommodate them better. And in lots of ways, the principles of UDL, actually, Universal Design for Learning, actually apply to a great extent in classrooms, because that child will not be the only one who requires any kind of change that is happening. There will be more kids in that class or in another class that you teach later on. So it's worthwhile thinking about it and seeing what you can do to accommodate it if possible. So the first thing is that I fully appreciate what a dreadful, incredible, far-reaching ask it is to have put into place a situation where lots of children have been put into classrooms by the government, successive governments for many years now, in great need of a much more supported program of education. And we needed and still need a lot of PD as far as this kind of teaching, special education type teaching, is actually inclusive teaching, how to be inclusive, what that actually looks like in a classroom. And I'm quite sure that there are people in the government who don't know that, and in the ministry probably themselves, because it varies so much from child to child, from class to class, and from teacher to teacher. And the worst part of it all is you have no training for it. I have to actually say and appreciate that you have, many of you, gone out of your way to try to accommodate these children and to try to do some research and understand the difficulties. And I fully acknowledge that is the case. So we're not on a back foot at all from that point of view, but we have got an overload situation, and I think that it's time to sort of look at that and see what can be done to help you out. So obviously we've opened a sensory room, which has been really good and gobsmackingly successful as far as I can see and as far as I'm concerned, because it has changed the lives of many children who, unfortunately, for nobody's fault, have just had to get the best they could out of the classrooms and teachers' programs to the best of, with teachers' programming to the best of their ability for these children. And when you consider the kinds of some really critical high needs kids that we have, then you'd have to say that actually it's ridiculous. It is almost not possible. To make it as possible, I think that you need to understand what it is that you are dealing with in this situation. So I think I better start by making some. You may know these things, and that's fine. But I'm going to say some things which actually put into place who these kids are and what you really need to start with. So in the beginning, the children that we very often get in who are high needs, and even the ones who are not labelled high needs but still are high needs, may not have ORs, may not have any funding at all, and very often those are the ones that are in the most need. You would have to say that actually We do our very best for them, and we're quite amazing at what we do, but I have to say that unfortunately there just isn't enough support for it, and we know that situation exists. So when we make an OARS application for children, that is a deficit document. It has to be a deficit document, although no one would ever admit it but the powers that be. I'm not saying our school, but in any school. But we all know that it has to be really truthful and very honest, but it has to say exactly the things that they cannot do. It's not like writing a sensitive, and it is sensitive all the same, but it's not like writing a positive school report. It's writing why they need the funding, and that is what you have to do. You have to actually provide the evidence within the criteria that they actually need this funding. And that makes it extremely difficult, and particularly when we're nice people and we don't like to say things like that. So it's hard. There are ways of actually approaching that document, and there are words you can use which make it less deficit. So that's one thing. However, the teacher is in a different situation, although obviously the OARS application is usually a collaborative document, very often done on Google Docs, very often done by all the teachers who are involved, all the stakeholders, and including parents, and even with student voice if you can get it. So we have a whole lot of things there that could be looked at, and so even though it's a deficit document, the teacher, when they're in the classroom, is in a different situation. And the very first thing that the teacher has to do is to build a relationship with the child who is almost non-responsive sometimes, or very negatively responsive. And that can actually even be quite scary. I mean, I know that there are situations that I have learned over the years not to take for granted, because things can happen to you that you don't expect, because these kids do not always behave the way, they're not predictable, they don't always behave the way that you would think, and they don't think the same way as you would. They may interpret behaviours by you as meaning something completely different to what you were trying to portray. So let me get that clear. So the OARS document and the OARS funding is for children who are at least, and I'm going to say at least again, at least 3 years developmentally behind their chronological age. And that's very important, because we have sort of benchmarks, don't we, about chronological age and what kids are supposed to be able to do. But they don't all do it, and we know that. And we know, for example, that not all children walk at the same age. Not all children can talk at the same age. But there are rough guidelines, and you know that when they're 3 years behind, that's pretty well behind. So teachers, if you have a 5-year-old in your class and they are high needs and we are doing OARS for them, they are at least 3 years behind. You do not have a 5-year-old developmentally, you have a 2-year-old. And if you have a 7-year-old developmentally, you have a 4-year-old. And it's not rocket science. It's really easy to work out. Now, on top of that, you have other kinds of things happening. For example, even though they may be developmentally at that stage, there are some things that are developing and there are some things that are not, and they're different for all of the kids. And if you have a cognitive report done on them later, you will see that actually they don't all have exactly the same set of neurological pathways which are operating in different ways. So, and they can be differentiated, they can be figured out, they can be pinpointed by a psychologist and a psychoanalyst, if you like, who actually knows how to do that. And that can be relayed to teachers, but it very often isn't. So that's part of it. But the main thing that you need to understand is the fact that they're 3 years behind. So that's one thing. Now, if you put a 5-year-old, if you put this person in a 5-year-old body and they're still only developmentally at the stage of 2, That may be true in some areas. In other areas, they may be a little bit more, and they may be a little bit less. So it's very airy-fairy, to say the least, about exactly where they are, unless you're a psychologist, in which case they will have tested them and they will know the actual areas where the need is and where the discrepancy is, if you like, or the deficit. So when you have them in your classroom, it is, I'm going to use this word ludicrous, because I find it ludicrous that we're trying to teach a 2-year-old to read and write because they're not ready. And I'm sorry to tell you that this 5-year-old is not ready. And your job at that stage, and you're doing a wonderful job, you're so patient and well-meaning and everything else, and it is what teachers do, teaching reading and writing and all those things, and literacy and numeracy, we know that, but actually this child is in need of a developmental program. And until they get the developmental program and the early emergent stages of everything and the developmental emergent level, then you're actually not going to get very far. They may learn a few things. I noticed that, for example, there's an exuberance around when children learn their spelling list. But that's rote learning, and it's at the very bottom of the taxonomy, of Bloom's taxonomy. So I want you to look and think about that, because there is actually very little learning going on in that. They are learning to do they're sort of repeating exactly, regurgitating what you've told them, or they are superficially learning something in a rote fashion. So is that useful to them? In the long term, it probably is. But in the short term, when you've got kids in your class who are not making eye contact, who are not verbal, they're non-verbal, and they are globally delayed and autistic, I actually think the first thing they need to do is to learn to feed themselves. They need to learn to make eye contact and build relationships with people. They will be in solo play, as all of our children in the first group that I have every morning is. They're all in solo play, and they are happy to be there. They have no concept whatsoever of outside the ego, particularly. So their world is about need and want, and what they need, what they want, and their sensory needs. So it's sensory and need and want, and that's how they operate. And the person who gives them most of what they need and want is their mother. And that's why parents are very, very important to our dealing with this situation, because they have a lot of the information that we need. And if we don't build the right relationships with parents, we also don't access the information that we need. So those are the things that are important, first of all. Now, what are we doing about it? Which is a really good question, I think, because a lot of people ask me, well, what are we doing about it? What kind of program do we run? Well, we run a sensory program, and it's developmental. Secondly, do we write a program or do we facilitate the program? Now, it's quite an old-fashioned word these days, facilitate, but actually we do facilitate the program, because what we're doing is we set up a lot of activities which are suitable for the levels, stages, and the interests of the children and the sensory needs of the children who are in our group. Once we've done that, the kids come in and they have learned something. They've learned, well, they come in with their mothers, and the mothers put their bags away. And while their mothers are doing that, they're actually learning how to do it themselves. And it's interesting to see how they have actually cottoned onto that pretty fast. So they put their bags in the big plastic container thing that's got their name on it and their book on it with their photograph, which is their communication book. And then they go off and they choose what they want to do. It's very much like developmental play in any kindergarten type program. but it's not a kindergarten type program. It is very much Montessori, very much Reggio Emilia programs, and they're important because they allow for the child to direct the learning. The child owns the learning. The child decides what they're interested in and what they're going to engage in and for how long, and we let them do that, and we follow them through their learning for the morning. Every child is has time where the teacher has gone and sat with them and gone and talked to them or tried to talk to them, and I will mention that too in a minute. And so they have time where they are being observed, and the teacher is 100% aware of what that child needs next. So it's really about observation by the teacher, setting up of appropriate activities, not a great deal of imposition of learning. And if the child doesn't like it, let it go. Don't push it. But repeat, put it back again. Put it back every day. Don't take it away, because sooner or later the child will come to that and want to do it. And that is what we are seeing at the moment in the sensory room. It is very common for toys that have not been so, that they're not the balls that you can throw out and things like that. They're going for the finer motor skill toys. The gross motor skill toys were the most popular at the beginning. But actually now the most popular ones are the, well, not so much the most popular, but the ones that they will also include are things like not tying knots on shoes, not shoelaces and things like that, but the other things are things like threading beads and that kind of thing. So there is a little bit of that going on as well. A highly popular activity has been the piano. And do we go over there and actually teach them anything on it? Well, I could, but I don't. And there's a reason for that, and that is because they are learning. The most basic thing they are learning is that the piano works on vibrations. And they are learning, the second most important thing is that it has different sounds, and they are learning how to make those sounds. They're not being taught how to do it, they're teaching themselves. And that's really important because it's tuning in the ear. The ear is a sensory vessel or portal, if you like, and they are very sensory. So they're getting a two-way thing, aren't they? Because they're moving their hands and they're getting this with their ear at the same time. So I think what we're seeing in that case is that that they are quite capable. The main thing is too, because what they do is they'll spend some time on the piano, but we don't say, if we can help it, we don't say, it's time to go and do something else. We give them as long as we can give them on there, and then they naturally look around and choose something else. Quite often somebody else is doing it, and they're learning to wait and take turns. And that is a big issue, because they do not like waiting and they do not like taking turns. The world is for them. The world is theirs. There is no one else in their world as far as they're concerned except their mother and their family, who they live with all the time. So that's who their world is. They don't really understand anybody else or anybody else's feelings. Therefore, they don't hesitate to hit, and they don't hesitate to bite, and they don't hesitate to pinch, shove, pull your hair, kick you, or spit on you. So there are some things in there that I'm glad not happening in your classroom, but that sometimes happen for us. So you know what it is that is actually happening in there. And we have high hygiene needs in that room, a great deal of them. And no water at the moment, but we will have soon. So that's good to hear. We also have a number of children who are not yet completely toilet trained, which makes a situation where, on the whole, we're managing really, really well, and we've had a lot of support from SLT with how to manage that better, and we have a very human rights-based way of dealing with it, because we see the rights of the child and the privacy and respect of the child as being very, very important in this case. So we've put up curtains and various bits and pieces that can help, and we always if we can, get them to the toilet. So it's really important, and that's why that reason and a number of others, but that one particularly is one that why we need more than one TA at a time, and also more than one person in there at a time. The other aspect of that is that at any one time you can have 5 children or more climbing on slides, climbing up the walls, trying to get out the doors, and they can all do it at the same time, in which case there's no way that they can manage if it's only one person. So that's why that is actually happening. It's for the safety of the children, and it actually calms the whole place down a lot, because we know how to handle these kids. It's changed. A lot of things have changed about the noise level, about how we introduce the day with sensory music rather than, a play school type thing. Play school program does come into it. We do use a little bit of that, because a few of them are actually singing songs, but they won't talk. They will sing songs. So, and they are making noises which are akin to singing. So we're getting a bit of that, which is really nice to see. Now, they are solo play. But having said they're solo play, you will also find that we are developing parallel play with some of these children. And it's the ones that you would not expect it to happen with, but it is happening. So our experience is that they have, if you want to see how it happens, it's quite interesting, because I actually have a video, so I will show you if you want to see it. But they circle each other from a very wide circle, and then they come in closer and closer and closer, and then they will join in with what the person is doing. If you as a teacher want to really succeed with these children, you have to develop that relationship. And you cannot do that by sitting at the front of the class and they're at the back on the mat. That isn't going to work. They don't sit on the mat. They will sit on the mat, but not for very long. So in a way, this is normal for those children. That's not naughty. That's normal. It's actually normal for any human being if you think about it, but they don't have the conditioning that we have. So, and they're not. They don't emotionally accept a lot of things because they don't feel in that way. They're not particularly empathetic at this stage. It's all ego. So with the solo play situation, it's really nice to see them play, but when you're making a relationship with them, don't stand up. Lie down on the mat. It's even better. If you get down so all they can actually see of you is your face and your head, you don't look so big. And not only you don't look so big, but they can understand that. They won't make eye contact with you. They may, for a fleeting moment, and you could lose them altogether by even forcing the issue. Forcing any issue, imposing any learning, confronting any child in this situation is not worth the effort, because actually there's no ill will against you or your program or what you're trying to do. They are just saying, this is me, I don't understand anything else. There's nothing at all ill will about it, right? So maybe later when they know a bit more, but at the moment not likely in the juniors, all right? And there's usually a message behind any of these, the temper tantrums and when you get kids throwing stuff or hurting other kids, etc., or just angry. That stuff is always about what's at stake. What is it that they're getting from this behaviour? And that's when you need to do things like functional behavioural assessments and things like that. And we can do that too. But the main thing is to always keep that in mind. Why are they doing it? What are they getting out of it? What's the purpose? What is the purpose of the behaviour? And I've seen children at our school. I've actually seen little kids who have done things, some very violent things actually, And if you come back to what are they getting out of it, they're just trying to express their anger. Something is worrying them. Quite sincerely, it is worrying them. So they don't know how to say that. They don't know what it is. They just know it's a feeling. So that's my answer to all of that. I achieved parallel play with a group of 4 kids the other day on the mat with the ball, and I actually got 4 high needs children on the mat with me, lying down, and all I did was giving tunes. It's your ball. It's his ball. My ball. Your ball. Not very difficult to do at teaching language. My ball, your turn, his turn. They got a lot out of it. Didn't say anything, but they got a lot out of it, and they smiled. You can tell by their eyes. Their eyes light up when they understand. Use that. Right, I've said enough for now. And if you've got any more questions, or you have some, you might have specific ones. I might be able to help you with something that you've got. I can't necessarily, at the moment, we're full with the high needs kids, but you can ask me questions, and I can help you with strategies. If you ask me, I will try. Well, that's me for the moment. I'm trying to keep you up to date with what's happening in the sensory room. Our lovely children are doing extremely well. If you want to see the photos and the videos, we've got heaps. Okay, see you later. Bye.